Welcome to today's talk session. My name is Deirdre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. In our session today, we will focus and talk about World AIDS Day, as December 1st is recognized as World AIDS Day. As a platform, we seek to inform. We want to talk about what this means to our community. So today, we welcome Denise Major, who is a prevention educator, to help us dissect this topic today. So at this time, I will pass the virtual mic to her to have her introduce herself. And I just want to say she's not new to this platform. She is our friend. And so today we welcome her to share with us today. So I will pass the virtual mic to her to have her present today.
Hi, everyone. So glad to be here again. I love coming here and crazy. It's been a year already. I just was here last year. So this year flew by pretty quickly. But like Deirdre said, my name is Denise Major. I work in the prevention education unit of the Bahamas National AIDS Program. And I'm a part of a team responsible for prevention education as well as community outreach.
Thank you. Thank you so much, Denise. So can we talk World AIDS Day?
Sure.
So, it's been a year?
I didn't hear you.
It's been a year?
It's been a year.
Okay, wow. Okay. Okay. Go ahead.
And then we did regional testing day in June also.
Wow, yeah.
So yeah, okay. Time is flying.
I know, right? Okay.
Yeah.
Okay.
So
so let's talk about World AIDS Day.
Yeah, so today is actually World AIDS Day. And the theme for World AIDS Day 2021 is End Inequalities and AIDS and Pandemics. So that's the global theme. World AIDS Day is observed every year, December 1st. And it's pretty much an opportunity to raise awareness, as well as it's a global event that is designed to expand and strengthen the worldwide effort to stop the spread of HIV and AIDS.
Awesome. Thank you. Thank you for that bit of information. And you said the theme is
End Inequalities and AIDS and Pandemics.
Wow. Okay. Awesome. Awesome. And so what are your thoughts? What are your thoughts about World AIDS Day? And what is the significance of this day?
Well, like I said, it's pretty much to support persons living with HIV, as well as to remember those who have died from the disease. So it's really important to show our support because that helps end the stigma and discrimination, and it helps us in our efforts to fight the disease.
Great, awesome. And so on this day, we not only recognize those living with it, but we also recognize those who would have passed.
Yes.
Yeah. Okay. And so your role and responsibility as a prevention educator, can you tell us about your role and responsibility?
Okay, so pretty much this is what I do. We educate, we inform, we go into the schools, we promote testing, we have testing events, we just spread the prevention message, encourage persons to come out and get tested. And for those who have contracted HIV, we encourage them and support them with getting treatment and care. So we connect them to our doctors, to our network, to ensure that they are in treatment, in care, and have all of the support that they need. So we will go to schools, we would go to community organizations, we would do shows. So we would do everything possible to get the message out there.
Yeah, thank you for sharing that. I remember when I was in school, they came to our school. That's how I learned a lot and recognized, the importance of testing, the importance of prevention. And so it's so important. I know when we saw those slides on the screen, we used to be scared as kids that, it could really have a toll on you. So you have to do the necessary precautions, get tested, and, do the work that you guys put out there in terms of prevention and education. That's so important. So I want to thank you for sharing that and mentioning that you do the groundwork. Go ahead.
And we start as early as school age because we have to get our young people educated and informed. There's a myth
What
that
age? What age you would say?
we start as early as grade 4.
Oh, wow.
And
Okay,
go
wow.
into and when we have the sex talk, we talk about body changes. We're talking about puberty. We're talking about feelings and healthy and unhealthy relationships. All of this plays a role in preventing HIV. Educating our young people is so important. By the time they get in grade 9, they have already had the HIV presentation done at least 4 times. We're talking about risky behaviors, how to, we talk about abstinence, we talk about protection, we talk about it all. And then by the time they're in grade 12, we really push stigma and discrimination also. So the conversation is ongoing, it's repetitive, but we try to find fun and creative ways just to constantly have it to the forefront of their minds.
Yeah, that's definitely important. I wanted to ask you, it's not, I just want to ask you a little bit because you talk about as early as age 4.
Grade
And
4.
I mean, oh, grade 4, sorry.
Grade 4,
So
yeah.
what would you say to persons who are just a little bit timid and a little bit scared? You don't want to really touch that subject at that, at that age.
But like I said, we start with puberty, the body changes and emotions. Hey, it's okay. You might like a boy or a girl, or you may feel a certain way. So that's really how the conversation starts. This year, a lot too, we've been focusing on talking to parents and helping them have that discussion with their kids, because the first conversation really should be coming from home. It really should. It shouldn't wait until they're in school, but some parents are a little uneasy or just don't know how to do it. So we it's a community effort. We talk to the parents, we talk to the kids, we have sessions with teachers. We try to make everyone comfortable and ensure that everyone is informed. And we provide the assistance also. So if a parent has a concern or they just want some tips, we help them with that also. So it's a village. It's a village situation we have going on here.
Yeah, definitely, because you do have some persons, they're not ready to really touch that topic right then and there. So you're saying that there's ways to kind of ease into that topic. You don't have to go into the full-blown topic, but there's ways to ease into that type of talk and into that type of discussion. And so as you would have talked about the programming and going into schools, as it pertains to World AIDS Day or any, and any other related activities that is scheduled by your department, can you tell us about any upcoming programs or any initiatives that you currently have, or maybe things that you would have already done? I know you talked about going into the schools, but do you have any upcoming initiatives for this day or any other scheduled activity?
Well, going into the schools, communities, organizations, that's something we do constantly. This week I have Rotaract, I had Zonta, I had different youth organizations or community organizations. So those are things that are ongoing. But specifically for World AIDS Day, I'm trying to pull up the calendar, sorry. Specifically for World AIDS Day, the events that we had going on, well, for the entire month of November, we were making our rounds doing the media appearances. So we were doing that for the entire month of November. And we're going to be doing it for at least another week or 2. We also had an essay a slogan competition for the high school students. That's still happening, where we're coming up with a slogan for 2022. We want them to be creative. For years now, we've been using Get Tested By and Know Your Status. So we're putting it in the hands of the young people now. Come up with some catchy slogans. And we have some awesome prizes for that. So we've extended the deadline for that. So they still have time to submit their submissions to us if they want to be a part of it. We had the school assembly yesterday that was hosted by Ellen Coakley and Exuma. So because of COVID, we've been able to get our islands on board. So Ellen Coakley High School in Exuma, they hosted the school assembly virtually, and they did an amazing job. Grand Bahamas on board. They had their church service today. So like I said, today is World AIDS Day. So their church service was at 10 a.m. this morning in Grand Bahama. And in Nassau, we had ours at 1 p.m. at Cousin McPhee Cathedral. So that's on our Facebook page. Persons can still watch it. We're uploading the Grand Bahama Church Assembly church service as well, so they're able to see what happened. The Fun Run Walk Cycle, that's ongoing. Well, that ended yesterday. So if you were driving around the island, you would have seen red ribbons. Yeah, that's us. So that's a part of bringing the awareness. We had a testing yesterday as well, and we're having another one on Friday, this Friday, December 3rd, from 8 a.m. to 2 p.m. So come on down, get tested. Everything is free. And what else is happening? Oh, we have a webinar tomorrow that can be streamed, that's being streamed on our Facebook page, Bahamas National AIDS Program. And we're talking about ending HIV and AIDS through treatment and care. So we're going to have our pharmacist as well as our senior nursing officer for the HIV program on that show. And that's going to be streamed on our Facebook page. And again, in Grand Bahama, they're having their 4th annual HIV AIDS Survivors Benefits Awards and Honors. So like I said, everyone has been taking the initiative. We had a testing in Exuma, we had a testing in Abaco. We have ours coming up on Friday. We had one yesterday. We're trying to get all the islands involved. We have sent out packages. So at the very least, they've been putting up the signs, talking about prevention and stuff like that. So we had a full calendar this year.
Yes, yes, you have a full slate of activities. So I wanted to ask you about the testing on Friday. Can you say the site? I know you said the time. Yeah.
So it's going to be at the Ministry of Health building on Rosetta Street, which is formerly the old Kalina building. So it's opposite Alive, right next to Susie Q convenience store. So it's going to be right there. We're set up in the parking lot, quick, easy, convenient. Bring a government ID, you must be 18 years and older. And the process takes about 30 minutes max. If you're there for 30 minutes, you're there very long. So no more than 30 minutes, quick, easy process. And like I said, we're there from 8 a.m. to 2 p.m.
Awesome. So that's Friday. You can get free testing. You don't have to pay for anything, right?
Testing is always free. HIV testing is always free. So if they miss Friday, they can come down to the National Reference Lab or give us a call to arrange a time to come in to be tested. So testing is free of charge. Everything is confidential. And it's easy access. We recognize that persons are fearful a bit. So we're trying to alleviate some of those fears by making it as convenient and comfortable as possible for them.
Okay, so that's Friday. Okay. And it was another activity that's upcoming. You mentioned another activity, the last one you would have talked about.
The webinar?
Yeah, the webinar.
Yes. So the webinar is tomorrow, is Thursday. Yeah, tomorrow at 7 p.m.
Tomorrow at 7, and you said the focus will be on
ending HIV through treatment and care. So we're going to have our pharmacist who's going to talk about medications and all that good stuff, as well as our senior nursing officer who will be discussing care and support, treatment, care, and support.
Awesome. And you have the time?
At 7 p.m. It's going to be streamed on our Facebook page, and that's Bahamas National AIDS Program.
Okay, awesome, awesome. Thank you so much. And as it pertains to AIDS awareness, what are your thoughts? What are your thoughts on the level of awareness in the Bahamas? Are you seeing people who are interested in participating in maybe free testing or, interested in knowing their status? What are your thoughts on the level of awareness in the country?
I mean, with COVID came in and took over everything. So a lot of the regular health, diabetes, cancer, everything pretty much got pushed to the side. But now that things are leveling out, people are still interested. They are still aware. Our clinic and our lab never closed. We were open the entire time. And people just didn't know, or they were fearful of coming out because of the COVID situation. So people are still interested. We would love for more to continue to come out. We would love for people to be tested on a regular basis, not just once. Oh, I did this for this, but no, every 6 months to a year, come out and get tested. So we've been seeing a consistent flow of persons. We would always want to see more. Come out, get tested.
Sorry, so you said every 6 months to a year.
As long as they're sexually active,
Okay.
you should be tested at least once a year. The higher the risk, meaning if you have multiple sexual partners, you're unsure of your partner, every 6 months, every 3 to 6 months is fine.
Okay. Every
Yeah.
3 to 6 months.
Yeah. The higher your risk, the more you should be tested.
Okay. All right. All right.
But if you are in a monogamous relationship, or if you're celibate, if you're not, just still come out, just make it a part of your annual routine to come out and get tested at least once a year.
Interesting. Awesome. 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 Okay. So let's talk about AIDS in the Bahamas. You know, as a prevention educator, can you share your views on AIDS in the Bahamas as it pertains to the rate of AIDS, prevention of AIDS in the country, and stigma, the stigma that is attached to it? You know, when you have the word and, you know, persons who may be impacted by AIDS, or they may have it, you know, the stigma that is attached to the word.
Okay, so for this question, I'm glad you asked it. I am going to share from our stats. Like I said, today is World AIDS Day. So we've been making the media rounds and we've been sharing the stats. So I'm just going to read a bit of it. So the Global Initiative to End AIDS, also called the Fast Track Strategy, aimed for bold, ambitious targets to be reached by the year 2020. That was last year. And that included identifying 90% of people living with HIV, to place 90% of those positive that we identified on antiretroviral therapy, meaning the medication, and to ensure that 90% of those on therapy were able to become undetectable. And that's the goal, that's the aim. Once we find out that you're positive, you're in treatment, the goal is that you become undetectable. So the Bahamas has shown steady progress to reaching these global targets. So we're doing an amazing job. Yes, we can do more, but we are on track. Newly diagnosed HIV infections decreased by 53% from 2010 between 2010 and 2019, with 133 new diagnoses in 2019. AIDS-related deaths decreased by 52% from 146 in 2010 to 70 in 2019. So we are decreasing. There were no reported cases of mother-to-child transmission of HIV in 2015, 2019, and 2020. We had no children born with HIV. And then treatment for HIV positive persons is and has been available free of charge, and 63% of people living with HIV in 2020 are on treatment. So our numbers are looking good. We're making steady progress. The number of persons in treatment represents an increase by 33% from the year 2013. So treatment is prevention with a person with undetectable viral load. Remember, that's the goal, and being unable to transmit HIV. So in 2020, 72% of people on treatment achieved viral suppression. They achieved the goal. So our numbers are looking up. We're doing well. We are well on our way. We just have to keep doing the work.
Awesome. Those are some good stats. Those are some good stats. And I like, where you said the transmission from mother to child is almost at, you said 0%? No transmission?
We had 0 transmissions in
Awesome.
2020, 2019, and 2015. So we had babies born.
Wow.
Once an HIV positive mother presented, we were able to put them on the program, put them on the meds, and their children were born HIV negative.
Awesome. And so let's talk about stigma. The stigma attached to, when you think about the word, when you hear the word. And so, what are your views on stigma attached to it? I know I can say, growing up, it was a lot of stigma attached. So I would like to hear, what are your views? What are your thoughts?
The stigma exists, I feel, as though because we aren't properly educated, we don't have the proper information. And once we get that information and learn about HIV, how it's transmitted, and how you can live a healthy life with it, the stigma will reduce over time. So it's very important. And we all are part of education. It's not just the 4 people in my department or 3 or 4. We all have a role to play in reducing stigma and discrimination. And it's really education. It's really education, debunking the myths, being empathetic, being supportive of our loved ones, friends, family members, and even strangers who are HIV positive.
Yeah, definitely. I feel like sometimes, there is a stigma attached. Maybe sometimes, it comes with the fear of maybe you presenting yourself, and even finding out and knowing your status, because you know that there's going to be some form of stigma attached. So it is a level of, stigma there. And I know growing up, when, I used to hear about the AIDS camp, there was even a stigma attached to that.
Yeah.
Is the camp still in existence?
The All Saints camp.
Yes.
That's still in existence.
Okay.
But we have persons living there who are not HIV positive. So, and again, it's really about education. It's about education, learning about HIV and everything as it relates to it. How am I affected as a child who is HIV negative, but I have a parent who is HIV positive? Because then as a child, I am automatically stigmatized also. And I'm negative. And again, that's why I said education and information is so important.
Yes, definitely. I'm glad you mentioned that education and information is very important. I know, and I thank you for correcting me, because I didn't even know the name, because growing up, I used to hear them say AIDS camp, but it's actually the All Saints camp.
Yes.
Right. Awesome. And like you said, you could be a child that is HIV negative with a parent with AIDS, and that stigma may be attached to you. So like you said, it's all about education, and we're here to do our part. And you, as an education, as a prevention educator, I want to thank you for doing your part and sharing your time with us today to talk about this topic, because it's so very relevant and so very important. And so I want to talk about your level of satisfaction as a prevention educator. Are you satisfied with the response of the community as it pertains to AIDS awareness in the Bahamas?
I mean, we are growing. I've been doing this about 10 years now. My daughter's 12. So I've been doing this about 10 years now. And there's always more to be done. But we have persons and organizations have been receptive to us coming in to teaching these programs, to educating their members. We have churches who are calling on us weekly. We have schools, we have civic organizations. So it's improving. It's really improving. Like I said, there's more that we the responsibility lies as us as individuals. There's always more that we can do. Disseminating accurate and factual information. Volunteering. We can volunteer with organizations that provide services for persons living with HIV. We can raise funds, we can organize events. We can just simply advocate. What you're doing now is advocating and educating. So we can advocate for those living with HIV just for their basic human rights, rights to privacy, rights to treatment, right? Just basic human rights. And just fighting the stigma and discrimination just by treating persons living with HIV with respect and dignity, just simply being kind. So there's so much we can do in addition to educating ourselves, in addition to getting tested. And then if I am a person living with HIV, staying on my treatment, adhering to my medical advice, adhering to my medication, all of that.
Yes, thank you. Thank you for saying that, and thank you for mentioning. It's just as simple as, being kind, being thoughtful as well. Thank you for sharing that. I think sometimes people may have a little bit of fear, but as you would have mentioned, knowledge is empowerment, and so you educate yourself in knowing how to deal with these situations, and understanding that this is something that's not spread by just a touch, or what I mean. When you educate persons, you give them knowledge to empower themselves. And so I want to thank you for sharing that. And I want to ask you about recommendations. What recommendations would you put forward to address AIDS awareness, preventing the spread of AIDS, and reducing the stigma of AIDS? That is the stigma that is directed toward those who are impacted. I mean, what are your views, or would you like to add to that?
I mean, there's always work to be done. There's always improvement to be made. As simple as prioritizing people who are not accessing the HIV services and utilizing the services or treatment. We can push that more. The legal policies and barriers that persons face that enable inequalities, we have to address those. We can create safe spaces and environments where persons who are most vulnerable can not experience stigma and discrimination because of their lifestyle choices or their economic status. So creating safe spaces is important also. And then we just need to focus on why persons aren't responding to what we're doing and tapping into that. And that's me as an educator, that's me working in the field. Like, okay, what else is there for us to do that we aren't doing? What aren't we hearing? What aren't we doing? Because we need to achieve positive outcomes with our programs. So the programs aren't working. Okay, it's time to do something different. Let's hear from you. We're open to the public telling us what we need to do to make it a safer, better, more pleasing environment for them to get tested and treatment, care, and support. So as it relates to prevention as well as treatment, care, and support.
Yes, thank you. And thank you for letting us know that your department, you're open to hearing from the public,
Yeah.
and adding their input to improving strategies that they feel may need some type of enhancement or need some type of improvement. I want to thank you for sharing that. And then you also talked about policies, the legal constraints. And that was so important. You mentioned that, you just glazed over that, but that's so important. Yeah, I mean, that's important. Could you just talk about that just a little bit? That's an important point that you raised.
I mean, it's simple as the rights of people, enabling them, empowering persons to know their rights. With our laws, child at age 16, a young person can consent to have sex, but they can't get any testing done. So some policies can or should be in place to
Is that for females or straight across the board?
The age of consent.
Yeah. Straight across the board, male
In
and female?
heterosexual relationships, male and female, the age of consent is 16.
16, okay.
In same-sex relationships, male, male, female, female, the age of consent is 18. So for those who are under the age of 18, they cannot access any treatment, care, or support. So me as a 16-year-old, I know I'm engaging in sexual activity, but I may not be comfortable in telling my parent or wanting them to know, like, hey, mommy, daddy, I need to go get an HIV test. I need to go get checked out for STDs. So what then happens is 16, 17, at 18, at 16, I may contract a virus or STD, and I'm having this virus for 2 years before I'm legally able to go and get treatment. So that needs to be addressed. We need some adjustments to the policies, some advocate for young people. We need some adjustments to that, because that's an issue also. Because we're telling them, hey, yeah, you can have sex, but you can't access treatment, care, or support. If something should happen, you can't protect yourself. You can't go on birth control. You can't be tested for these viruses or diseases. So that's something we really need to look into. And then at 16, I may have contracted something and I continue having sex, and therefore I'm spreading whatever it is that I contracted. So we have to look at it holistically and come up with solutions that would safeguard our young people and then our community at large.
So at 16 years old, I can decide to have sex, but I cannot make a decision to prevent pregnancy or prevent go ahead.
Without the consent of my parent or guardian, legal guardian.
But I can consent to sex without the assistance of.
Yeah. So that's something we really need to look into.
Interesting.
Yeah. Totally off topic. I'm sorry. No, but not totally far off topic.
No, it's not off topic. I mean, it is an issue. It is a legal issue.
It is a serious issue.
It's a legal issue. That's definitely not off topic, because these are the things that we need to look at. Does it make sense? Please make it make sense. At 16, you're able to consent to sex, but you're not grown enough. You're not old enough to prevent pregnancy. You're not old enough to take those preventative measures to prevent catching STD or to get tested. To get tested. You need parental consent.
They can ensure that their partner uses condoms, but to know if I am disease-free,
your status
of parent consent or guardian consent, to know if I am disease-free. Yeah.
Okay. So what advice would you give to an individual who might be impacted by, AIDS, or who might believe that they are infected with the disease, but they're afraid to get tested? What advice would you give them?
It's always better to know as early as possible. That's the advice. Get tested. It can only be negative or positive. You may be worrying for no reason at all, but why take that chance? The sooner you find out your status, and this is why we said to get tested annually, make it a habit so you don't even think about it. This is just something I do annually. This is something I do every year. And the sooner you find out, the sooner you can get treatment, care, and support. So it's best to know. It's best to know. You're not only protecting yourself, but you're protecting others. Because I don't care how cold-hearted you are, if you contract HIV or any other STD, and you continue to spread that, that's going to weigh on your conscience. I'm thinking it would definitely weigh on mine. So it's always best to know for your personal well-being, your personal health, your personal safety, as well as that of others.
Thank you. Thank you for sharing that. And is there any, as we wind down to the end of our session, are there any additional comments that you would like to add? Is there anything else you would want to share or anything else you would like to talk about?
I just want to encourage persons to come out and get tested. Testing is key. Come out, get tested, know your status. If you're in a new relationship, before you get intimate, come out and get tested. If you haven't been tested in a while, come out and get tested.
Oh, that's a good point. Oh, you raised some good points. So let me ask you, you're in a relationship and you don't want to ruffle the waters per se. So but you want to get tested. How do you ease into that conversation? How do you
That really should be one of the first conversations you have. Honestly, I mean, it's 2021 now. Come on now. We are sexually empowered individuals. This should be one of the first conversations we're having. And it shows that you care about your health as well as the health of the other person. If the person is hesitant, move on. Like for me personally, if I say, hey, well, not if I say, that's the criteria for dating me. We need to go get tested for everything, and not me saying you need to go. We're both gonna go. So you're gonna know my status and I'm gonna know your status, because if this is something that we're doing, we need to do it right. Now, if it's a one-off situation, a quickie, a fly-by-night, a one-night stand, use protection. Use your condoms. Make sure you're protected. But if it's a real relationship, before you get intimate, get tested. If there is the boat rocks and there's some situation in the middle, you don't trust him, he don't trust you, get tested. Use condoms, get tested. And it's about being smart. We have to take this stance now. I don't care about your feelings. I care about my health and well-being. If you have an issue with it, well, obviously we shouldn't be connected in that way. I'm sorry. I just prioritize me and my health.
That's you. What do you have to say about the young woman? She's in a relationship. She really likes the person. That's you. Hold on. She really likes the person. And she don't want to really rock the boat yet. And she don't really want to come off offensive. That's you. You
okay, so I'm
familiarized. So how do you start that conversation? Ease her into that conversation.
You're the young woman, and the easing is being blunt for me. Now other people would do it differently, but for me, and I would ask her, are you more concerned about rocking the boat or contracting a sexually transmitted infection? What are you more concerned about? If something in this relationship is making you suspicious, put your health and well-being above it all. Get yourself tested at the very least and use condoms. At the very least, you get tested to know that you're good, and make sure that you use condoms until you get your partner tested. And unfortunately, I know it's harsh and I know I'm very straight speaking. I don't know how someone else would do it, but for me, I am very blunt. You as women, sorry men, but as women, I am very passionate about this. I don't care about rocking the boat. I have children. I need to be healthy, safe, and whole for my children. I want to have children. If it's a young lady without children, you want a family, you want to, so think about these things. Some STIs prevent you from having children if left untreated.
That is a good point. I want to thank you for sharing that. Definitely.
So think about all these things.
Yes. That's a good point.
Yeah.
Now, I'm not talking about you. See, I'm not talking about you. I'm thinking about the young lady who may be a little fearful, and I want you to offer her some help. Okay. Now, I with you. Yeah. I can go blunt. I can go full force. But what about the person who's just, they know what they stand for. They know that, okay, they want to go in a relationship and they believe that the way to go is to get tested. But they need to know how to approach that conversation. I'm not talking about me and you going to go jump in and say, we need to get tested now. No, but I'm
No,
talking
I'm not
about
saying that either. And I think too, what makes this difficult, our culture, we don't really discuss what dating is. We just go ahead and have sex, and then we have this conversation. We have this conversation after the fact. In the getting to know stages, in the talking stages, in the cutting up stages, this is when you talk about sex. As soon as he started talking about, hey, send me that pic, or hey, you looking sexy, like this, like when was the last time you got tested? When was the last time? Have you ever been tested?
so oh my God, Ms. Major, so you are
I
gonna
tell my children this, I have a 22-year-old. I tell her this, and she, oh Lord, she could kill me, but she is shy, she is but you have to put your health first. And if you don't, right? If you are, even if you go and get tested and be like, hey, guess what I did today? I got tested. You want to go too? And I think it's easier for both parties, instead of saying you need to go get tested, no, let's do this together. Let's make this an experience. Let's find out each other's status. And I think as scared or unsure or timid as someone may be, knowing that they're taking their health and putting their health as a priority is sexy. It's empowering. I respect you for that. That means, hey, if a guy asks me to go get tested, I'm like, oh, okay. It shows me that he is taking life seriously. I wouldn't feel offended. Like, I think the average woman would be like, oh, what do you think I is? You think I all about, we have to change our mindsets a bit too. Look at it like, hey, we're being concerned about our health and well-being. As hard as it may be, I know it's hard. I know. But for me, I just find that telling someone bluntly, like, hey, prioritize your health over anything is so important. And like I said, I use the example, I'm a mother. I want to be here for a long time for my children. I tell, and this is the tactic I use with my daughter, you want to have children someday. So getting these tests done on an annual basis is good. He wants to live a long, healthy life. He needs to go get tested. Like, come on, we have to get a little, aggressive with this a bit. And just know the person you're talking to and know how to ease into it. Everyone is different, but using that tactic and saying, hey, prioritize your health, that's a sure way to go.
Agreed. Your health is your wealth. As cliche as that may sound, it is what it is. So you have to, you have to be strong about that. That's your health. That's very important. So I definitely agree with you as pertains to that. You have to have those hard talks, have those hard conversations. And so it's your health. Your health comes first. And so I want to thank you for sharing that. And I also want to thank you for sharing that little tidbit as well as it pertains to some of these, these are very serious viruses that can prevent you from prevent you from possibly starting a family. So that's why it's so important to get tested and to get treated and catch them early and use whatever preventative measures that you can use to prevent them, because I know you sometimes can take there's some level of treatment for some viruses as well, right?
Yes. So some of them is just a short course of pills or short, and you're over and done with.
All right.
It's easy. It's simple. Now,
so you wouldn't know unless you get tested.
You have to get tested. Getting tested is key. You won't know some of these. Well, definitely with HIV, you can't look at someone and see their HIV status. So getting tested is the only way to tell if someone is HIV positive or negative. So getting tested is key.
Awesome. Ms. Major, is there anything else you would like to add? Anything else you would like to share before we end today?
Well, that's it. And pretty much to invite everyone to the testing event. Like I said, it's 8 to 2 at our Ministry of Health building on Rosetta Street, the old Kalina building, which was formerly Kalina, opposite the live next to Susie Q, the big white building. You can't miss it. We'll have the tent set up outside. We'll have the big signs that says free HIV testing. And we are there from 8 to 2. You can come on down on your lunch break. Before you go to work. We're there from 8 to 2. And it takes, like I said, roughly 30 minutes max.
Awesome. You could be out there?
Yes, I am.
Okay, I have to see you
I
out
will
there.
be the one signing you up and counseling you prior. I will
Awesome.
be right there.
Awesome, because it's important. It's definitely important. Like you say, testing is important. So I want to thank you so much for sharing with us today, Ms. Major. We appreciate you. We appreciate your knowledge and insight, and the fact that you're very candid about this talk. You're candid about this conversation. I think you're just a little bit too blunt, but that's okay.
I work on it. I'm working on it.
No, that's you. Oh, no. We love that. That's fine.
Yeah.
We love you the way how you are.
I gauge my audience. Like if I think the person can handle it, I'll tame it down a bit.
Yeah.
But for the most part, what you see is what you get. I
mean, it is. Sometimes you just have to come straight forward and say it is what it is. So because I can't fault you for that at all.
Your health is important. You have to, be aggressive with your health.
Absolutely. Absolutely. So I want to thank you for joining us today. You're welcome back anytime. We consider you our friend. You're a friend.
I'll see you in February. February is our next key time. Our time. February, June, and December. Those are special time.
Yeah.
All the lovers and the new lovers. Make sure that
Valentine's Day.
February. And then in June. And then World AIDS Day. So we have it spaced out good.
Yes. All right. Thank you so much, Ms. Major. I would like to thank you for joining us today. I would like to thank our viewers for listening in. Like our page for future notifications of upcoming talks. Comment under our videos. Let us know your thoughts and let us know what you want us to talk about. You can subscribe to our YouTube channel, Can We Talk? Follow us on Instagram and Twitter using the addresses provided on our page, using the social handles that we have available. We're also on TikTok and LinkedIn. We're everywhere. So follow us using our social handles provided on our page. Thank you, and Can We Talk? Thank you.